Hello, everyone. I'm Jeffrey Wolt, Editor-in-Chief of retailmediaIQ. Welcome to our coffee chat. Today, our guest is Mike Carmody, Vice President of Pharmacy Services at Advanced Diabetes Supply, a Cardinal Health company. Mike, great to have you with us.
Jeff, great to be here. Thanks for having me.
Let me begin by asking you about how Advanced Diabetes Supply came together and emerged as a leader in the diabetes supply space.
Yeah, it must be over 22 years, I think, now that two gentlemen, Tim Cady and Mark Howard, started the company out in Carlsbad, California. They'd been in the diabetic supply space on the DME side for many years prior to that, and just saw a lack of, customer service, in that space. And their whole idea was to, start a company specifically focused on diabetic supplies being delivered to the home that provided excellent customer care. I've been with the company since March of 2019, and I can certainly say that continues to be, our number one strength, our number one focus. I couldn't be more proud of, what we see from our patient intake team, just across the board, and how they manage the difficulties of all these crazy insurance policies that are out there, and working with a lot of senior patients and just trying to make it as simple for them and trying to navigate that landscape. So all they really need to focus on is receiving those diabetic supplies to help manage, their disease state the best that they can. And then come April 1st of this year, as you mentioned, Cardinal Health came in and acquired us. We're part of Cardinal At-Home Solutions, which has been just incredibly exciting. The number one thing that they said was the culture that ADS Supply Group brought to Cardinal Health At-Home Solutions matched up perfectly. The people have just been fantastic. Just always having that focus on patient is, the number one concern. It's why we come to work.
How has Advanced Diabetes Supply benefited from the relationship with Cardinal? How has it changed your business?
One thing is Cardinal at Home Solutions and their group EdgePark is fantastic at the organizational, movement of putting people in the right spots to help those patients once we, are working with them. At Home Solutions has 11 distribution centers around the country. So we're going from 3-day shipping for our patients to next day shipping, wow. Which, is, in our day and age, now, we all want everything immediately. Mm-hmm. So that was the number one thing. Number two, I would say, when it comes to patient access, bringing together all of these companies in the commercial medical contracts and Medicare Advantage, obviously Medicare Part B, when we put it all together, we have over 90% of the lives in the nation covered. We hope to go, from right now, the 6 million patients that, our group at Home Solution Services to over 10 million in the next 5 years. That's our goal once, we're able to do that integration and see those synergies come to light.
And like you mentioned, CGS, continuous glucose monitoring, if there's anyone out there that's not clear on that. What hurdles is that posing for retail pharmacies out in the marketplace, and how are you guys trying to help them with that?
It's certainly been, an increase in the standard of care that, is so important for the diabetic patients out there, which, as I just mentioned, is, sadly an incredibly growing patient population. But, when it comes to some of the difficulties, the challenges, the hurdles that are out there are numerous, sadly. First and foremost, I'd say the complexity of the policies at the payers, certainly presents a challenge, especially in the pharmacy space. When everybody's used to, billing in real time and getting your answer right back and, what that cost is going to be. Granted, you might have some audits, after the fact, some clawbacks, but that's just not the case, for the most part, when CGM is predominantly a medical benefit and you don't know, exactly, are you going to get paid? Did you meet those policies? There's a lot of upfront work, proactive work that needs to be done with medical records and working with the physicians and working with the patients that, it's just not in the workflow of community pharmacy, and for good reason. That's number one. I would say number two is technology. The pharmacy industry is pretty well advanced when it comes to technology. When you're looking at e-prescribing and all the interoperability and things of that nature, we still do a ton of faxing to doctors' offices to obtain these medical records, which are crucial in making sure that a patient is truly qualified for their CGM device. We want to do everything we can to make sure that if that patient is eligible and they meet those policies that are out there, that they will receive at their doorstep that CGM. All this chasing that's going on. And then finally, the reimbursement, is difficult. When you're weighing all those operational costs, if you're going to try and outsource all the medical record collection and think of things of that nature to third parties, you're just not going to get the same bang for your buck.
Tell me about how people get involved in the program. What are the requirements? What are the enrollment steps? And what are the costs?
Yeah, as far as getting enrolled and how everything works, we do have a good implementation program. We lay everything out. We provide a payer sheet where the pharmacies go in, they set up a mock adjudication, which they're already doing with their Medicare Part B clearinghouses, things like that. We get the enrollment list for all the stores that are going to be utilizing the service, so we can do the proper reporting on a weekly basis for those patient interactions. So when the patient does come back in to get their medication, you can ask, hey, okay, Mrs. Smith, how are you doing on your CGM? Have some diabetes self-management training, anything like that possibly you could do some billing for on an ancillary basis. Once we have you all set up in the system, it's a really straightforward 3-step testing process that takes maybe 2 to 3 minutes. You just send a couple transactions, and we verify that everything's being done properly. It's a perfect solution for those that do have Medicare Part D provider numbers and those that do not. Everybody wants to have those patients still coming in to the pharmacy so you can provide the Part D as in David medication. And that's what, when we created this solution, that was the whole idea, to retain those diabetic patients for what your focus is on for your business. Ultimately, this is a great solution, not only for CGM, but for BGM and test strips and Lancets. Our company was built, and Cardinal Health certainly pushes, that best-in-class customer experience. But we take it an extra step. We focus on the fact that we're an extension of our pharmacy partners, and we know how great of a service they provide.
That's a great track record. Let me ask you what may be the most important question, and that is, what does continuous glucose monitoring do for the patient?
I mean, first and foremost, it gives them access to data immediately, and they don't have to prick their fingers 4, 5, 6 times a day any longer. So fortunately, this time I don't have diabetes, but if I did, that would be a huge issue. I have tried, a CGM, and it's way easier, certainly than I can imagine pricking your fingers, and just having that data right there at your hands, and also being sent to, your doctor, your caregiver, your wife or your husband. For children, like I said, I have 12-year-old twin boys, being able to receive that information immediately, being able to have the school nurse immediately receive that information, is incredibly important. And with the way technology is advancing now, with the insulin pumps talking to the CGMs, it's just that in-loop network is so far advanced of, where we were when I started in this industry 20 years ago. It's mind-boggling. And I can only imagine that it's just going to continue to get better and smarter. For the diabetic patient, it's a game changer.
Final question for you, Mike. Aside from the continuous glucose monitoring, what are other trends that stakeholders should keep an eye on as we go forward?
Not on a product standpoint, but I'd say the next big thing in our industry around diabetic patient service is going to be competitive bidding when it comes to Medicare Part B. We've all gone through this, for well over a decade now. Rob and Anthony at our company and a lot of the folks who work in our government relations offices have been on the Hill trying to do the best that we can to provide the information around customer access. Patient access is paramount to being able to provide customer care. We'll see what's going to shake out with that, here in the near future. I know that they're supposed to have some announcements coming up by the end of the year. I do know that our solution and certainly Cardinal Health is well positioned to service the patients around the country. I think when it comes to the pharmacy landscape, it's going to be a little bit difficult, probably with even more reimbursement pressures and that lack of access. But I think this pharmacy services solution that we have for CGM, and the partnerships that we do have and can potentially have, will still allow that continuum of care to be there, for all the diabetic patients that are out there.
Thank you for sharing your insights with us, and we'll certainly keep our eye on those developments. So thank you, Mike.